The rotator cuff is a group of muscles that surround the shoulder joint, as you can see here. There's 4 of them, and like all muscles, they have a muscle belly, which is this red fleshy portion here, and a white tendinous portion. And so when the rotator cuff tears, essentially what happens is the white tendon comes off the bone. And that's what a rotator cuff tear is. So with rotator cuff repair, essentially what we're doing is we're taking that torn tendon and repairing it back onto the bone. If you give the body enough time to heal that, the shoulder will essentially function like a normal shoulder again. All the rotator cuff repairs I do are outpatient procedures, and we do them all arthroscopically, which means we make small incisions about this big, scatter them around the shoulder, we put the camera into the shoulder, and we do the repair in a minimally invasive fashion. The recovery is basically, you're in a sling for about 6 weeks to allow the tendon to heal. You do start physical therapy 2 weeks after surgery. And by 3 months, I let patients get back to things like lifting weights, playing golf, swimming, things of that nature.